Well, good morning. We still have several people that are signing in, so we're going to hold just another minute or two before we get started, but I'm delighted to have everybody with us this morning. All right, let's go ahead and get started. Does everybody have their mask handy? I hope so. Welcome to Crisis Management for COVID-19, week 12. Can you believe it? It's been 12 weeks. We're only about 13 weeks into this whole thing, so we started early, and we're so glad to have so many of you join us and kind of keep up to date on all the latest changes. And boy, there have been a bunch more this last week. So we're excited to have some great guests with us today. We'll flip to that. I'm Lyle Hanna, and the Hanna Resource Group is hosting this, but we've got Jim Morris. Jim, you got that next slide there? Yep. Got it. Something got a little out of whack there. We lost Jim's sound. I hope we had him beforehand. Wouldn't that be something? Well, I'll just tell you, if you've been on here before, you know Jim and what a great asset he is to our calls. And I know he has been working all weekend. He's decided he quit doing them on Friday because by Sunday, so many things had changed, he had to redo them. So all weekend, he's been working for the past 8 or 9 weekends on these updates. And he's got a lot of things to share with us. And for some reason, he's lost his sound, and we're not quite sure why. Because we had him just before the call started. Chase, any ideas here?
I'm unmuted. Can you hear me?
All right, we got you now. So Jim's going to be with us. Well, Jim, we need the next slide.
I know. Sorry.
That's okay. That's pretty funny. So, you know what? I'm excited about this. We also have 2 superstars from Mercer this week. And Doug Frederick and LaCinda Glover, I'll give a little more introduction about them a little later, but they help run the Louisville Mercer office and actually have clients all over the nation. And they've got a really great poll that they're going to have us take. And it's going to help us all see where we are compared to everybody else in terms of what's going on in our organizations, and really give us some more clues about things that are going on across the nation too. So that should be a lot of fun. Allison is back, and she's going to be coordinating questions. Autumn is going to be helping with that, and Chase is going to be running the slides for the polls. So let's get going and see what we can do. A lot of ground to cover. Jim, take it away.
All right. So, sorry, I'm trying to get things running again. For some reason, everything shut down on me right at the beginning. So, you know who I am, so I'm just going to skip to it. So, we have big news on the Ppp Flexibility Act. A couple of things I wanted to make you aware of. Some of this is regurgitating what we talked about last week. So on June 3rd, Congress actually passed the Ppp Flexibility Act. It is now law. It was signed by President Trump on June 5th. So it changed a lot of things. First, PPP loans are available through December 31st. If you haven't gotten yours by now, you haven't been listening to me for 12 weeks, because for 11 of those 12 weeks, I've been telling you to go get your loan. Second thing is the 8-week forgiveness is extended to 24 weeks, but no later than December 31st. That's a little different than I had last week because that was kind of in the small print. So it's either 24 weeks or December 31st, the earlier. Third one is the broadening of the safe harbor to December 31st. Now, this dealt with the full-time equivalency and some of the other things, but the exception that they've built in is really interesting, because I don't know of a single employer who could not utilize that they can't return to the same level of business that was operating before February 15th, 2020, due to compliance with sanitation, social distancing, or other COVID-19. Watch for that to be fleshed out, because I see the SBA is probably going to have to come up with rules as to what that means during what time period. How do you calculate the percentages? how are we going to figure out, because it's not going to be a straight line boom on December 31st. Can you meet that standard or not? But the other thing that's in there that's a little different from what I talked about last week is, and I don't know if this is just a glitch. Last week we didn't have, Congressman Barr didn't mention this, so I don't know what the plan is. I don't know what the issue is. But in this third, I'm going to get my highlighter going. In this fourth bullet here, you'll notice what I've bolded here. The SBA had said that you had to spend 75% of the forgiven amount on payroll. That's been changed by the Ppp or Flexibility Act to 60% of the total loan amount. This is going to impact people like the factory I gave you the example of that I'm representing in Chicago. I've talked about it a few times, so I'm going to use that same example. They said, hey, we're not going to use it because we can't open during the 8 weeks. I expect to have a call with them today about what they're planning on changing based upon this change in the law. But the question becomes, for those that decided to just keep the money and they were going to then pay it back with interest instead of blowing it during the 8 weeks or the 24 weeks, this changes it. It's 60% of the total loan amount instead of 75% of the forgiven amount. In some ways, and this has not yet been talked about by anyone, in some ways, 75% of the forgiven amount is actually a better calculation than 60% of the total loan amount. And if you really sit down and start thinking about how you're going to spend your money and so on, you'll see that the way the 75% was finally at the end determined in the interim final rule, it said of the forgiven amount, not of the total amount. And so it sounded like a great deal up front. A lot of businesses were pushing for 50-50. That 60% is nowhere near as good as what I thought it was last week when you start realizing it's the total loan amount. So if you ever had any intention of keeping part of that for the future at such a low interest rate, they've kind of screwed that up. So look for that to be addressed as well. The extending of the term of the maturity sounds like a great idea, except for one huge issue, and I'm not quite sure why they did it this way. I think 90% of the businesses have already gotten their loans. So the extension to the 5-year maturity only applies to any business that didn't get it before June 5th when it became law. If you notice, I'm not showing you anymore how much money the SBA still has. They still are sitting, I believe, on $100 billion. I haven't looked this week to see. They've run out of businesses seeking money, so everybody that ever wanted it has gotten it, or they've just been too lazy to do it. The irony is, the longer you waited to get your money, the smarter you ended up being, because then you didn't throw your money away during the 8-week time period, and you can actually use it once you open. I'm sorry for those of you who jumped in early. It was important to do because they were running out of money, but they come out with a guidance 7.5 weeks in to change the 8-week rule to 24 weeks. It kind of screws those that spend it. All right, borrowers, you have to begin making payments 10 months after the last day of your 24-week period, but not any earlier. That was changed from the 6 months that the SBA put in. The SBA, as you recall, said you had to start paying back whatever amounts weren't forgiven 6 months in. Here you go. Change that quite a bit, and that helps. It permits the loan borrowers to defer payments on employer payroll taxes. If you recall, in week 3, I believe I went into detail about during the time period of your PPP forgiveness, or once it's determined, once the bank determined that you were forgiven on any amount, from that date forward, you could not use any of the deferment of employer payroll taxes. This changes that. You can now do both. And then the third one, except for extending the term of the maturity, again, going back to this 5-year, it's something, Congressman Barr last week said something about banks didn't like it because they didn't want to change their bank agreements with their borrowers. But except for this one bullet point here, all of the rest of this is as if it was written into the original PPP. So this last bullet down here is just so you realize, if you go to the SBA, and I checked it again this morning, it is still operating on the 8-week with all of the calculations and how you guys are supposed to do it, when you're supposed to do it, all of that information. So be careful, because that's not been updated. I don't know when they're going to update it, but that's not the accurate date. So, all right, next issue. I brought this back. This is an oldie but a goodie. We talked about it in week 2, 3, and 4, and I haven't mentioned the FFCRA since then. It's been a while. I thought I'd bring it back because you wouldn't believe the new issues that are popping up, and I actually had to laugh. So the sarcasm is on me. That's on the next screen, and you're going to see it, but it's real frequently asked questions. So, little refresher. Week 2, we talked about up to 12 weeks of leave at 2/3 of the employee's regular rate of pay for care of a child whose school or child care provider is closed. Now, there's a little bit different calculation for sick leave versus FMLEA. We're not going to go through all of that. It was a whole lot of calculations in week 3, and I did it broken down. You can go back and click on those slides. Shockingly, now that it's summer, surprisingly, some employees who didn't need time off for their children when they were at home and there was nowhere else to go, the parentheses are my little added, are suddenly needing time off to care for their children. Fortunately, the DOL has issued some assistance, somewhat. Following are real frequently asked questions from the DOL, rewritten for your listening enjoyment. All right. So here's a frequently asked question with, again, if you see the top here, the sarcasm is courtesy of me. This is not exact, but I'm not kidding. This is really darn close. So I've been successfully teleworking since March with my kids going to school remotely. Now that it's summer, however, and everything is open, I really need FFCRA leave to cultivate my suntan. Take care of my kids. Can my employer seriously ask me what changed and why I need to leave? A definite maybe. And this is literally in the frequently asked questions. Employers, quote, must exercise caution in asking, quote, and I love this language. I was like, who on the DOL actually came up with this precise language? Lest it increase the likelihood that any decision denying leave based on that information is a prohibited act. They don't tell us what the heck they're talking about in a prohibited act, but then they come up with a really good news from the DOL. This does not prohibit you from disciplining an employee who unlawfully takes paid sick leave or EFMLA leave based on misrepresentations, including, for example, and I bolded this because I couldn't believe that this is in there, to care for the employee's children when the employee, in fact, has no children and is not taking care of a child. The next FAQ, or the last FAQ, is almost the reverse of this, and then their answer is even more sarcastically ridiculous. So that's why I went ahead and changed the FAQ to actually ask what employees would be asking, because you all are in the HR side, because I was just blown away. So the good news is, if they don't have kids and you put them on FMLEA, then you can discipline them. They then go into, in the last one, a little bit about whether the school really is closed and what you can do with it. This is you're gonna see a lot of litigation coming out of this. You're gonna see a lot of employees taking full advantage of you with this, and that's why I put this back in here, because now that it's summer, all sarcasm aside, people are like, wait, if Disney World opens and I haven't used my FMLA leave, and I got to take care of my kids and school's closed, I can go to Disney. Watch, wait till the last one, because you'll love it. It's coming up. Next question. What can I ask from an employee who wants FFCRA leave because of COVID-19 symptoms and seeking a medical diagnosis? This is the actual question. The answer had a whole lot of garbage in it, but it boiled down to symptoms, date of the doctor's appointment, don't ask anything else. You're not entitled. You can't ask. It gets into invasion of privacy. Don't ask. So I put it down that simply because that was the next question. Yes, we're up to 93 questions on frequently asked questions on the FFCRA. I stopped in week 3 at 46, but the rest of the questions were seriously, really ridiculous. So I didn't go into them. Question just popped up, frequently asked in this on the chat. What about test results? If your employee tests positive and can't come in, they can't come in. You can't get into details about it. So symptoms, yes, you can ask them that. This question here is they want leave to go seek a medical diagnosis. So this is not after the fact. So the chat that just popped up about what about test results, this is literally you all, HR, you're going to have to deal with employees going, oh, I'm hungover, but it feels like a headache and I think, yeah, my throat hurts. I'm not coming in today. The only thing you can do is say, what symptoms do you have? And of course, they've answered it every single day coming in. What's the date of your doctor's appointment? Okay, you can go. Now, after the fact, the chat about what about test results, you can ask them, did you test positive? What was the result? Can you come back? You can't really force an RTW, return to work, document, meaning the form of the document. Yes, you can require them to get something from a doctor. Remember the CDC, EEOC, OSHA, everybody's saying don't force a legalistic doctor's note. Be careful with that. But yes, you can ask them if they have symptoms. Sorry, I should have emphasized this is only seeking leave and you have to pay for them to be able to go get their medical diagnosis. Once they have the medical diagnosis, you can ask them what that is in terms of whether they can come back to work safely and so on. Next question. After successfully completing distance learning and not taking any leave from my employer because there's nothing to do outside of our house, my kid's school is now closed for summer vacation. Cool places are now opening and I really want more time off. So can I ask for FFCRA or sick leave to go somewhere cool and take care of my kids? Seriously, the question was almost that blunt. It didn't say anything about going on vacation with my kids, but it literally said schools are closed. I was homeschooling before, but now that schools are closed for summer and I want to do something else, can I take FFCRA? And it said, no, of course not. You can't do that because the basis for you staying at home would be school's open or school is closed and you don't have any other alternatives. But wait, there's more. They came up with, and this is where I'm like, for HR people, I'm sorry you're in HR. Legal, it means I'm going to get more work. But for HR, this just kind of sucks. It says, however, the employee may be able to take leave if his or her child's care provider during the summer, a camp or other programs in which the child is involved is closed or unavailable for a COVID-19 related reason. So if your employees successfully work from home, and I mean, it went on and on and on about, you may not know, they may have been doing their dual role, but now it's not really working out for them, or maybe their spouse was available, but now their spouse is not. And maybe their school, now that they're not in school, maybe they just need more time. And if they can come up with they had a program that they never signed up for it, but they were going to do the LFUCG, for example, pool program. Now the pools are closed, so they don't have any pool to take care of their kid, no lifeguards. Or gee, we found a program that we were going to send them off to this little-known Vermont day camp or summer camp, and now it's closed for the whole summer. I need 12 weeks off at 2/3 pay. You're going to get a whole lot of that because any of your employees who really look into it, this frequently asked question basically says, hey, go find a camp that you were going to use and now you can't use it. And now you just need to take the summer off to go on vacation with your kids and have your employer pay for it. I hate to bring that to you, but when I saw these FAQs pop out right in time for summer, it's really that blunt and it's not cool. So, next thing I wanted to cover were some potential legal issues for employers. We've gotten a whole lot of FAQs, a whole lot of questions, and things that I thought you guys should think about, especially when we have, and I'm sorry about the bottom bullet down there, that's me not knowing how to have things show up. We'll talk about that here in just a second. That's immigration, by the way. But there are a lot of things that, areas of HR that you're just going to deal with. So benefits. You all need to, we talked about this in week 1. All the way back in week 1, you just need to be aware of these types of things that are going to hit in the future. These are going to be litigation issues, contract issues, legal issues, HR meshing with legal, risk management. You're going to have to figure out what you're willing to do and what you're not. But these are the areas that I'm seeing from my clients that are just starting to come out of the woodwork. These are all alphabetical, so these are not in list of importance, but these are in list of what you're going to see alphabetically. Benefits, your plan terms, in whether you continued, ended, furloughed, however you reduced hours, whatever you did to your employees. You need to verify. Again, this was our week 1 caution about workers' comp policies, working from home, and furloughing, and what do you do with your employees? You've got to make sure that your administrative documents, your healthcare policies, so on and so forth. What you did, does that match your plan terms? Did that match your administrative practice, and does it match legal requirements? So that's an area you all need to be aware of. Contracts. 3 big areas. There was a 4th one in here I'm going to throw in. I just didn't have a whole lot of space here, and I also, it's not as big, but I'll throw it in there. You're going to see some issues, and you all need to be prepared for breach of employee-based contracts, because if you cut people's salary, you cut bonuses, you furloughed, you reduced hours, you did different things. Some of you have contracts. They aren't just at will. You've signed an agreement that says that they're going to get a percentage of X, or they're going to get a bonus. Those things are going to start to pop out. So you need to pull out those agreements you have with all of your employees and verify what you've done. Make sure that you're not in violation, because those contracts did not include, typically, hey, if we have a worldwide pandemic, and hold on just a second, all of you yelling at me, it's the 3rd one right here, so just wait. A lot of the contracts have no provision for what if we have a worldwide pandemic. So you need to pull out those contracts. You need to verify what's in them, because if you cut salaries, some of those things may be illegal, and people aren't really paying attention to it now because, hey, they're getting unemployment, they're getting different benefits, they're not really paying attention. If you terminate any of those employees, you really cut them back, you don't bring them back to full, whatever, that's when you're going to start to get hit with lawsuits. So I see some of those. Another outcropping is this 2nd one. I'm going to, a lot of what I've done in the past has been a lot of non-compete, whether I'm hiring people and getting them out from non-competes from different states and different contracts, different provisions. And another one is enforcing it for various companies and customers. I see a whole lot of that starting to gin up right now as people are plucking people who are on unemployment, because a lot of employees on unemployment think that, wow, I've been fired, so my non-compete is not valid. Not true. Typically, now these are all contract-based, so I'd have to see them, but typically contracts are contracts are contracts. Doesn't matter how you got fired, they're still enforceable for a 1-year, 2-year, 3-year, 5-year, depending on where it got signed, whether it's valid, so on and so forth. Those contracts are still valid unless this 3rd one we're getting ready to talk about. Most of them don't have a force majeure clause because most employers don't include that. But you're going to end up with a lot of litigation over contracts for non-competition, because people are seeing good talent on unemployment, and people are seeing a valid way to go to a new employer, and they're taking it. I see in the near future we're going to be dealing with a lot of that. Keep that in mind. The last one on there is force majeure. If you don't know what that means, you need to figure it out, because basically what that means is, in the absolutely unforeseeable event of some type of worldwide pandemic that really is never, ever, ever going to ever happen in real life, or a worldwide disaster that shuts down the entire economy. And I've had so many clients laugh at me in the past when I included that in every contract I was doing, and they just were like, it's never going to happen. Why do we keep putting it in here? Because one day there might be a pandemic, and then you'll go, oh, yeah, I remember why you put that in there. Pull out every agreement you have, especially the form ones, especially if you have conferences with hotels or conference centers or anything like that, because guess what? There's a force majeure clause, and guess what? If the hotels are closed right now, you can get out of your contracts, because force majeure says if a worldwide pandemic occurs and there's no way to put on a meeting, you can get out of it. The other one is, I see a lot of contracts, and this, I'm not going to spend any time, I just want you to know about it. There's a lot of contracts related to hiring people, and a lot of people postponed hiring during the pandemic. I see that there's going to be some contract modifications, not necessarily litigation, although I could see people trying. They won't get very far because of the pandemic. But if you didn't have a force majeure, you're going to have people suing over, I was guaranteed a start date of March 1st, and I never got paid, and it doesn't matter that I didn't work because it's a contract. See some litigation coming on that. COVID-19 legislation litigation, compliance with the FFCRA, state and local leave, CARES Act, retaliation for FFCRA, retaliation for all of the different things. You're going to see some down below. Just be prepared. There's going to be some legal issues there. Discrimination retaliation claims. I short shrifted this. I could have gone on for pages. National origin because of the Wuhan location. Race, Chinese race discrimination. Disability and FMLA discrimination. The failure to provide reasonable accommodations under the ADEA. At home, we've talked about this for weeks, starting in week 1, going through week 6. I think we hammered it every single week about, you got people working at home. They're still entitled to all of the reasonable accommodations. Some of the, and I wanted to say this, some of the EEOC lifting of some of the really strict rules about working from home, and saying that if it's a financial cost to the company that you didn't have to do it. Some of those are going to ease because your company's back at work. So don't plan on saying, well, I couldn't buy the keyboard because it just cost too much. That's not going to fly as businesses are opening. You got to start buying if you can afford it, and they're going to start going after you if you don't. So look forward to a lot of challenges on FMLA discrimination, failure to rehire employees after they were laid off, furloughed, so on and so forth. The question up there, I'm going to go ahead and answer it to everybody. About the documentation of the camp and the child care services, says, this is the one where it said, you may ask, but be careful lest you get sued for engaging in, this is the frequently asked question about the FFCRA. Be careful lest you get sued for asking the question and doing it for an improper purpose. So they said you could, but you better be darn careful doing it. So there you go. Employee expenses. This is a big issue for HR. If you're requiring people to work from home, their cell phone, if they're using it, you need to look into that because you're forcing them to use it. Wi-Fi, internet, office expenses, office supplies, paper, pencils, paper clips, computers, printers, printing paper, all of those things. If you're forcing them to use it at home and you didn't supply it, you need to backtrack and try to fix that so that you don't get challenged later. Immigration compliance, I gave away the answer, sorry about that. Immigration compliance, I-9 E-Verify is back up, really going after people again, especially in the Chicago area. Ask me how I know. The factories up there getting reopened, we're dealing with that again. Failure to pay H-1B versus paying H-1B. If you remember, I think in week 3, my weeks blend together. I told you about the lawsuits that were going to come out because H-1B had no exception. You're required to pay your immigrant workers unless they take vacation. but then you're going to get sued by your U.S. workers because you couldn't pay them during the pandemic. There's going to be all kinds of messes with that whole H-1B, whether you're paying or not paying. That's really a big mess that they've created. The DOJ audits are starting back up. ICE is starting its premium review of applications under the H-1B. That process is getting rolling. Interviews are getting started. If you're not up and pushing that, you need to start. If you haven't renewed visas, you've got to get going on it because they're getting ramped back up. All right. Next, NLRB, talked about it last week about the OSHA NLRB issues of employees. Retaliation for refusing unsafe working conditions. You're going to see a lot of that, whether you work at Walmart, whether you work at a law office, whatever it is. Remember, we've had questions about opening mail, hazard pay, whether you pay hazard pay, and I've cautioned you, if you call it hazard pay, then you're admitting that that's a dangerous position. Be prepared. There's going to be some backlash you'll see down below about the workers' comp, but I've talked about that for a few weeks as well about workers' comp challenges we're going to end up having. OSHA workplace safety, safe workplace, claimed workplace infections, reporting of challenges, whistleblowing on the employer not doing what they're supposed to do under the governor mandates, the federal mandates, CDC mandates, and then retaliation occurring. I see that being a big hotbed for a long time. Union relations. This is going to be a big one for some of you if you're not aware of it. We talked about it in week 3, and it's still an issue. First, your collective bargaining agreements compliance in light of COVID-19. If you close down operations, if you furloughed employees, you're going to get challenges. Secondly, because you furlough in a non-union location, furlough, layoff, or termination, you need to be prepared for union organization efforts, and you need to start training your managers on employee relations, what they can and can't do, trust me, I've done full in-house seminars for employers. You do not want the NLRB to hear anything that you did that was wrong, threatening people, surveilling people, doing all of the things that you're not allowed to do. It is a very serious thing, and I see a huge union backlash because of the layoffs of people once the federal money's run out. So if you need to be careful about that aspect. The other one is, we talked a little bit in week 4 or 3 about the impact on mid-sized companies, because if you took the money under the FFCRA, not PPP money, they had additional funding available. They threw in a huge issue in the CARES Act, not the FFCRA, I'm sorry, under the CARES Act, there was a huge red flag thrown in that nobody was really paying attention to, and I cautioned all of you that fall into the 501 plus. If you took any of the money from the federal government, you agreed not to challenge union, not to question union, not to even ask for a polling vote on unionization efforts. There were all kinds of issues. You need to go back and look at those slides. I didn't include them here, but I see that now becoming a big issue as companies open. Wage and hour issues, big issues I think you guys in the HR need to be careful of and be aware of. Improper calculations on layoffs, furloughs, reduction in force, reduction in hours, pay cuts, etc. That's going to be a big issue. You're going to see a lot of FLSA questioning and so on. The other one, and I've had this issue before COVID, and it's why I've been cautioning you about the temperature and symptom checks, even at home. If you are requiring an employee to do anything, they must be paid for the time spent. It's called donning and doffing for anything that's PPE related, and we had that, believe it or not, in the Tyson food area. Tyson wasn't the client. But if you are having to put on your protective masks and jackets and everything else, you have to pay them for that time putting it on. So you're doing temperature checks, if they're standing in line, if they're waiting to do their screening for the day, you have to pay them. There will be all kinds of lawsuits related to the failure to pay for the time period of people standing in line. One of the big questions I've gotten from a client in New York, maybe in Louisville, maybe in Lexington, I haven't had any yet. Cincinnati, the New York is also based in Cincinnati, so they've asked me across the country. Big concern is, so you work on the 87th floor, and the elevator only allows 6 people, and there's 400 people standing in line. Do we have to pay them for standing in line? And the answer is, you pick the 87th floor, you pick the time that they needed to be there, and they're under your control while they're waiting to get to the 87th floor. Now that might change, but the answer is they're under your suffrage, they're under your control, and you're supposed to pay them while they're trying to get through your apparatus, which is the elevator, to get to your floor. My suggestion is to pick a different start time, switch up things, allow people to come in on rotating shifts, work out an arrangement with the other people in the facility. But yes, if you're doing temperature checks, as soon as you start that, they're working. You can't get out of that. If they're salaried, congratulations, you pay them no matter what anyway. WARN Act compliance, we talked about this in week 1, week 2, and week 5, I believe, but we talked about if you're going to lay people off, close the office, even for COVID-19, even temporarily, you were required to come up with a notification to all of your employees regarding what you're doing, why you're doing it, how you're doing it, etc. If you didn't do that, be prepared, because WARN Act, mini WARN Act, I didn't include it in there because it just takes up space. You're required to comply whether or not it was a pandemic, whether or not it was government shutdown related or not. That's why we included it in cautioning you to be careful not to just close your doors. You have to do it in the right way, giving right notices, because all of the federal rules still apply. Lastly, workers' comp, covered it week 4 to week 8, I believe. I really expect you're going to get a lot of workers' comp claims from 2 things. One of them I listed here, the other one I didn't. The first one is infected employee. Because people used the designation of hazard pay, because of all of the potential exposure at work, you're going to end up with a lot of infected employee claims for workers' comp based upon COVID. But you're going to get a lot of challenges from employers because it's like getting the flu. It is not yet determined. I think we actually talked about this in week 10 as well, when we went down through and talked about how the federal government has not yet allowed this to be called a certain type of illness, so that it won't fall under like black lung and asbestos and some of the others. I think they will never call it that because they're hoping to stop workers' comp claims, because you can't prove whether somebody got it getting dinner or going to the grocery store or the movies or getting it in work. So they're going to be very careful about expanding that. But some of the states have already literally adopted a COVID-19 workers' comp. And in those states, Kentucky's not yet one, but there was talk about doing it. You're going to have some real issues. That's it on the slides. I'm into the the questions and answers. The one thing I will tell you under the question and answer before we get to any of them, I didn't put the slide up because I'm just getting sick of doing it, but the unemployment insurance is still broken. I know I've said that, it's just a broken record. I will tell you that I ended up, employee morale is sometimes more important than trying to save a few dollars and realizing that the state is ruining the employee morale. So of the roughly a dozen employers that I have assisted with their Kentucky work share, Kentucky short-time compensation pursuant to 787 KAR 1:350E, which is the Kentucky work share agreement regulation. I did a dozen. 7 of them I have assisted in basically telling the state because they're broken. We are canceling our work share, not that we should, not that we can afford it, but that it's clear that the employees are getting absolutely destroyed by our state not doing its job. I can tell you that none of them got any compensation. It didn't matter. They said it was all because they made too much money. They went back to the week 2 strategy of saying if you make too much, you can't get it. One of the employees was at minimum wage, and because they reported that they were back at work part-time, they immediately lost all federal, all state, all monies altogether. I still have one individual who never got anything all the way back to April the 3rd application. The rest of the employees did. One individual did not, and there's no way to get any information from the state. The new executive director has not been hired. They still have links to the employer handbook for COVID-19, and if you click on the link, it's still a dead link to a 404 error page. There's no guidance up there. There's no time share or work share, short time compensation. If you do want any of the information on that, you can send me an email on the 787 KAR 1:350E. It is now posted as regulation that has been adopted by Kentucky on the emergency regulation page, but that's the only page you'll find it unless you go to the Legislative Research Commission. They're just not doing anything with it. So I don't know what else to do to help you with it. Like I said, the majority of the companies I'm serving as general counsel for have backed out of doing any of the short-time compensation. They were trying to assist their employees while they were still getting them back to work. Because, as a lot of you have pointed out to me, with minimum wage being $42,000 a year right now with the federal and state, or somewhere around that wage between the two payments, makes it really hard to have people come back to work. We were trying to make it ease them back in with some federal, a little bit of state, and some actual work out of the employees. But when it didn't work, most of them backed out, and they're now just paying full wages and losing the money that they can't afford because they want their employees to be happy with them. So that's it on the Kentucky unemployment. I just didn't put the page up, and I'll answer whatever questions, or if you want to move on, I can try to answer them during the rest of the presentations. Up to you, Lyle, and anybody else.
Allison, do you have any other questions that have come in that might be good to pitch his way now?
Yeah, we've got a couple. So looking for a recommendation on Kentucky OSHA. So they want retention of records for 30 years. Do you think in relation to COVID that's just documents related to positive cases, or those that are directly work related? And do you think that would cover the 30 years? Would the 30 years cover things like temperature
daily tests,
checks, etc.?
Yeah. So the daily health checks and the daily temperature checks are under a CDC guideline, and they have indicated that you don't even have to keep those as long as they're not positive, as long as you verify. My recommendation has been to keep those in the red file, which is the employee medical file. They tell you, if this is the way the CDC, OSHA, EEOC have said, if you keep them, you must maintain privacy, confidentiality, et cetera, et cetera. Well, I think it's dangerous not to keep them, especially when one of the governor's 14 mandates for opening the business is that you have the ability to trace, that you have the ability to assist in any tracing, et cetera. Well, to me, that means you need to be able to pull out your negative results and say, look, I have this list. The employee said for last week, I felt great. We never got a reporting. That way you don't get sued by your fellow employees, by that employee, or that the government doesn't come in and file some kind of shutdown order injunction because you didn't adhere to your mandated requirements. I think it's dangerous to shred. However, I think that Kosh needs to give some updates. I think that Kosh, I've been picking on unemployment, but the Kentucky Occupational Safety and Health needs to step in and do some updating as well related to COVID, because they're not giving any guidance to say, yeah, we know you have to keep these related to occupational safety and health if you have, whatever, asbestos and the rest of the reasons. A negative test is not a result. And OSHA has come out and said, look, we understand reporting and retention. My recommendation is that you pull the OSHA and that you adhere to OSHA, that if you're really concerned about it, contact the executive director for Kosh. However, in general, if you can point out that, look, OSHA is saying we don't have to maintain these long term as long as you are being sensible. My recommendation has been to each one of the companies, as long as we're in COVID and as long as you're doing operations, I would keep those every day for as long as we're doing COVID screening. If CDC lifts the COVID requirements of a daily screening, of a daily temperature check, of the requests, the question and answer, at that point in time, I think you can destroy those safely and or archive those in the red files of those employees. I do not personally, I've not researched the 30-year requirement, Kosh versus COVID. So I'll look into it for next week and I'll give you a little update. But my recommendation has been to people to follow the OSHA recommendation, because if you start getting bogged down, especially the companies I represent that are in 45 states, how in the world are they going to try to comply with 45 state OSHA requirements? So we've been recommending they stick to the federal, maintain the records for the time period of the COVID crisis. Once the phases are lifted in all the states, and once you've got tracing under control, and once we get beyond this, hopefully, then we'll deal with what are we going to do with these. And I think at that point, you're able to either archive or safely destroy. That's how we've been handling it. And I'd be interested to find out if Mercer has a different approach. Legally, this is such a fresh area. We typically go top down federal, because then we have a legitimate thing to point to with the federal OSHA and say, look, they're telling us what to do there. We're following their guidelines. Then if Kosh comes in with it, it's kind of ridiculous to say for a negative result that we kept it for COVID-19 when it ended for privacy concerns. And keep in mind, the other part of this that I'd love to point out to Kosh if they ever challenged, we're under a federal normal EEOC where we can't do these tests. We're not allowed to do an on-site temperature screen. We're not allowed to do an on-site question and answer about people and how they feel today. That's illegal under the EEOC, under the ADEA. We're allowed to do it now because of CDC. We're allowed to do it now because of the pandemic. Surely to goodness, you don't expect us to keep those where private information may be used for 30 years. If it ever gets accidentally released or our system gets hacked, it's another way to have private information out there that we never would have been allowed to have except for the pandemic. That's the way that we approach it pragmatically. If it's wrong, I'd love to hear OSHA or Kosh come after us, because we're trying to protect employees' rights on a negative test. So, not really legal. That was just more sarcasm, but at some point, legal has to give way to reality and risk management, and that's one of those that I think would be over the top with a 30-year retention. Just my opinion. Question about Muncie, no. Muncie McNamara, no circumstances have been divulged yet, but if you send an email to Muncie McNamara, it bounces back. He is no longer affiliated with the Kentucky Unemployment Insurance Commission. And last week, I think, is when I pulled up the screenshot from the governor saying our system is broken, we need to fix it. The Friday before that evening, so what was that, the 28th of May, Governor Majeure announced that the entire system was broken. It's going to be moved under the Department of Labor, which I'm not sure is a great thing, but it can't be any worse. And he said that there would be new management that there was a switch. So Muncie is gone. Anything else? We still have 10 minutes on this time, so if we need to answer some, we can. If you want to move on, Lyle, and then we can just have a wide question and answer at the end, I'll try to answer some of the ones on there if you want to do that. It's up to you and the chat and Mercer group.
Let's get on to the Mercer stuff. It's going to be exciting, and we'll have a chance at the end to do some questions. How about that?
Okay, sounds great.
All right.
Sorry, went too far.
Let me give a little more introduction on our special guest today. Doug Frederick is here with us. He's been with Mercer for 26 years. He has run the office, Mercer's Louisville office, for many years. He focuses a lot of his attention on executive benefits, executive compensation related things. He's an actuary. He's a member of the American Society of Actuaries, and just a super guy. Does a lot for our communities when he's not doing consulting work. And he is joined by LaCinda Glover. And LaCinda is a principal with Mercer. She's the leader of the career practice organization that focuses on total rewards, consulting, and other compensation related things. Just delighted to have the two of them here. They've been working with all of their clients and other employers and have been sharing a particular survey that they do. I think you're going to find it fascinating. Hang on, we're going to get your input on this, and that'll make it worth even more. The more input we get from you, I think the better off this will be. So let me turn it over to Doug and LaCinda. Thank you all for joining us. We're delighted you're here.
Yeah, thanks, Lyle. Thanks, team, for having us. And the goal here, I know we're halfway through, so we're going to make everybody wake up for a second and do some poll questions, get a little bit interactive. And what you're looking at now is just some resources that we have. These are free resources available to you on COVID. I know Lyle and team have done a fantastic job in keeping you up to date on many, many things that's going on. Mercer has a lot of industry surveys, global surveys, sort of just across the board that they're doing. I think we're on survey number 5, and they run them for several weeks, and then you can access those results instantaneously. So definitely worth looking at if you have some questions on even some of the stuff that you heard already today on the call. And our goal is that we're going to go through these poll questions and then just spend a little time at the end for if you have specific questions on workforce rewards, executive rewards, what we're seeing, kind of where we think things are going. We'd be happy to answer those as well. And then after each poll question, we're going to stop and just talk a little bit about what Mercer is doing as a large global organization that has over 8,000 US employees and locations in all 50 states, maybe 49. Doug can correct me if I'm wrong. And then also be able to share a little bit about what we're seeing from our clients on some of those questions. And then we'd love to hear from you. So we may ask a few of you if you answer or if you answer some of the responses, if you wouldn't mind sharing, because I think where we found these to be very helpful is just to get ideas from our clients and other colleagues and organizations that we're working with as to what they're doing and what's working well, and maybe what they've learned and some things that they've already changed. So before we hop into the poll, Doug, do you want to add anything, and then we'll jump right in?
Yeah, thanks, LaCinda, and Lyle, appreciate the opportunity. Our comments here are kind of represented in 3 themes. Broad brush, if anyone's ever worked with Mercer, we pride ourselves in our ability to conduct really robust, incredible compensation and benefit surveys. But at this time, the concept of a survey is a little different. It's interesting that so our data is going to be one based on what we've polled our clients and what we've observed from the public airways, but different from a traditional pay study where everyone reports what they've done and they have complete information, different than a snapshot of benefit policies. We're going to organizations and they're telling us what they know at that point in time, what they believe going forward. Our poll surveys are, again, subject to what they're willing to divulge and say at that time, and so it's always changing. But we found between what we get in the public airwaves and between our spot and poll surveys, it's directionally correct and it's following what everyone's doing. The other 2 bookends are we're going to share what Mercer is doing from a Kentucky perspective, which we have 700 colleagues in Louisville, as well as what we're seeing across the U.S., and we have 8,000. And then as LaCinda talked about in the rewards equation, some of the interesting consulting we're doing with our clients around the impact of rewards for their team, as well as maybe a revisit of the HR team needed to deliver. So with that, I'll have LaCinda jump into the polls.
Yeah, and Lyle, quick question for you and the team. If somebody has a question, are they able to unmute and chime in, or do they need to do that through the chat?
They usually do that through the chat.
Okay.
Yeah, with 140 people, if we open it up that way, we end up with a nightmare. So chat's the way we've been doing it.
Perfect. So if we ask something and, we call on you if you've answered, if you don't mind putting in that in the chat, and that way everybody can kind of see that response coming through, I think that would be great. So perfect. All right. So Chase, I think you're leading the poll. If you're ready. Okay, perfect. So the first question here is, and we'll leave these up for about a minute, maybe a minute and 15 seconds to give people time to really respond, is what percentage of employees have you allowed to return to work as of today? So when we look at the way that Mercer has viewed the COVID pandemic, if you will, is respond. So many organizations are in that respond phase still and figuring out workforce issues, whether they have to take workforce actions, and how they're handling their current workforce, into return, which is where a lot of organizations are now, or at least some phase of that return to work. And then the last phase is reinvent. So you have respond, return, and reinvent. And we find most of our clients are somewhere between that respond and return piece, but they're already thinking 5 steps forward on that reinvent and what's changing. And we do want to talk through some of that on our time today. So.
Let me ask, because do you want Chase to show the results on that poll?
Yes.
Once he's done? Okay.
Yes, if you can share those. And then after the call, if we can capture those responses, I don't know, Chase, or if someone could snapshot those, and then we can make sure that we send those out afterwards too, so that you guys have those results. And I think one of the question was, does this include everybody who was allowed to work from home? And I think here we're talking about how many of those have you returned back to on-site working? And we will get into kind of what percentage you've done there for everyone. But for this one, we're looking back to where they were working before COVID. Okay. All right, so it looks like the results are in. And this one, I think, hopefully just helps us set the context for those that are on the call and where we are in that return to work cycle. So it looks like a little less than half have over 80% back, which I think is significant, right? That's a big portion. And then you have others that are, still at less than 10%. So you can see when I mentioned that cycle of respond, return, reinvent, organizations are sort of all across the board in where they are in that, based on, the operation that they run, the industry that they're in, et cetera. Okay. Doug, anything you want to add on this one, or do you want to go ahead and go to the next one?
Yeah, I think it's key. It's dependent on the industry they're in and how mission critical it is to have employees returning to work, especially if you're in customer facing. So organizations, for example, like Mercer, that we can probably get 90% of our pre-COVID work done at home, have been much more cautious of the return to work. For example, our Louisville site, we're targeting 10 to 20% of our pre-COVID staff after the 4th of July, and by year end, maybe 50%. So for organizations that can effectively continue to work at home without a big business disruption, they're being very cautious. Organizations where their revenue cycle just is halted, they're willing to take more risk and figure out the logistics and move forward faster.
Yep. Okay. So Chase, if you don't mind, we'll go to the next one. Okay, so to meet the healthy at home, so for Kentucky companies, the healthy at home requirement for temperature and health checks are you, and you can select more than one of these, but having your employees test at home, testing on-site by your own staff, testing on-site by external vendors, something else, or in a different state where that's not required. And Doug, maybe do you want to talk to what Mercer's doing here while we have them select, and then we can review what we see?
Yeah, building on what James mentioned, Mercer's approach has been at a federal level what's required in all offices in all states. Secondarily, let's go to what given state requirements are, and then whether we have to supplement or deviate. But Mercer as a whole has gone to the point of having people self-check when they're at home, both temperature as well as a qualitative check. For us, though, the devil will be in the details, that right now we're running below 5% of our pre-COVID. When that gets up to 10 or 25%, starting after July 4th. The logistics, James, of what you mentioned of how we do that, document it, will be very interesting. But at this point, it's been on the employee's honor system.
Yep. So you can see it looks like about 2/3 are having employees test at home. Testing on site by their own staff is about half. So it looks like maybe some people are doing a little bit of both. Not many using external vendors, and then there's other. So curious if you said other, if you would mind maybe just highlighting over there what you meant by other, that would be helpful. One of the questions that we also had is for those that are testing on site, what are you doing? Are you doing regular temperature checks, something different? And we did have one Kentucky organization that indicated they took some of the savings for physical products. They didn't need to use toilet paper. They didn't have as much kitchen supplies over the last couple of months. And so they took that money and they purchased some really cool infrared temperature cameras that when you walk in the door, you stand in front of a little plexiglass screen and they scan your temperature using these infrared temperature or thermometers that they have. And it makes the process go very, very quickly. It's a manufacturing company, so they have a lot of people coming in and out. And it's a way for them to easily check that. So I thought that was a really interesting way to do that as well. And it also kept people pretty far apart, so they weren't having to get close to do that temperature scan. So there's someone else that was using that infrared thermometer, which I think is interesting.
The other key decision points have been, but one, the number of employees they have at a given site will dictate the process of whether they can do it themselves or need an external vendor. The second is whether they're in a large office. And some of our major offices in New York and Chicago are having to deal with not only a large Mercer headcount, but they're existing in an office space that may have 5,000 to 7,000 people. So the building as a whole is developing certain protocols that then in addition, Mercer has to comply with.
Very interesting.
Okay.
Yeah, and I can imagine some of the larger cities, in addition, if we go visit our New York office, it's a very detailed security screening, like going through the airport. I could see some of the temperature and COVID screenings happening at that level in addition to what the employer's requirements are.
Yeah, I have an organization that's in the Bank of America building, and Mercer's in there as well in Charlotte. And they just said logistically getting people to their office in the elevators and only allowing 2 to 4 people in an elevator at a time, it would never work, right? It just can't happen. So until requirements change in that area or in Charlotte, they just can't allow as many people back to the office because physically they can't get them up and down where they need to go. And most people don't want to do that many stairs, right? I might start out 6 feet apart from someone, but then I'm going to stop and catch my breath after 15 flights of stairs, right? And get too close. Okay, let's go into the next one.
Interesting. Have you seen the elevators that now work with foot pedals as opposed to push buttons?
Very interesting.
I've just seen them on TV. I haven't seen them in person, but that's kind of interesting. You get a big, tall building. I don't think you could put enough pedals on there.
Yeah, no kidding.
Yeah, some of the Vegas casinos were talking about doing that to try to be touch-free and have the patrons use their feet to select.
Right.
Yeah. Okay, so this one is, at what point do you anticipate having 75% of your workforce back to normal working? So for those of you that said you're already back at 80% to the office or the physical location, I'm assuming you'll check by July. And for those that aren't, when do you think that you'll get to 75%?
Yeah, while we wait for the results here, regardless of the rate and pace of organizations having their employees return back to their physical facilities, from our perspective in working with our HR and finance partners at organizations, we are slowly but surely seeing them move past COVID, and certain key initiatives and special projects that have been on hold are now starting to move. In tandem, they're tackling the physical logistics of getting employees to return, but there is a little more optimism of return to normal on the revenue line for a lot of our clients and willingness to take on projects. And again, to LaCinda's point, getting to that respond, beyond the respond phase to the return and reinvent we'll talk about later.
Yep. Okay, so this looks like about 38% are saying by July, 12% by September, 23% by the year end, and then 20% at undetermined as well. And so this is one that I think it depends on where you are and what state you're in, right, in terms of the capacity and when that will be back to 100%. Social distancing is still very much in place in Kentucky. And so if you are bringing more people back, are you able to accommodate keeping people spread out, community areas, that type of thing? And we'll get to some of those questions as well. And I think, you know, for this one, when we think about being back to 75% versus 100%, that's very different, right? So many organizations and many of our clients are saying, we don't know if we're ever going to be back to 100% of what we were before. We think that some people will continue to work from home, right? Or they might have a staggered schedule and they're never going to come into the office 5 days a week. So Doug, I don't know if you want to talk about this. I know you led the office for a while, but just in kind of real estate and office planning, how we think that's going to change things.
Yeah, kind of a couple perspectives. I mean, Mercer right now is forecasting a goal by the end of the year to be 50% and sometime in Q1 to get to 75, but we don't know if we'll return to 100% physically being in the office. And it begs a really interesting question, long-term, what real estate needs are needed. So organizations later will talk about changes in the composition of the workforce needed to deliver their business post-COVID, the rewards the employee may want post-COVID, the other pieces of the facilities and real estate side that some organizations are reconsidering. And it's an interesting balance because a lot of companies were going to a more open architecture, smart offices that relatively had more employees per square foot. Mercer went to that, had great people model, great development. Post-COVID, that doesn't comply with the 6 feet. And so there's going to be a balance of, we think, honestly, less people will be in the office, but we need more space per body. And I'm very curious to see how that's going to shake out in real estate needs. Kind of curious, based on the chat, if anyone else is dealing with that or considering revisiting in 2021 or later this year the real estate space.
Yeah. Yeah, and one thing that I want to talk about kind of on this topic is just the shifting EVP, right? So employee expectations are changing, and Mercer has a great piece, and Lyle and team, we can share this when we follow up with the results of the poll on flexible working. And this piece was written in mid-May, and so it's very timely in looking at just adaptive work and what flexible work really means today. I think at the start of this, we had a lot of clients come ask, what does our work from home policy look like? What should it look like? We feel like it's antiquated. You know, we want to change that. So that's part of it. But, you know, flexible working is more than just where you work. And so when you think about flexible working, it's the old Richard Scarry, like who, what, when, where, why, how, but who are you working with, right? And I think that's changed somewhat too, as we've had more virtual working sessions. I know I usually spend a lot of time face-to-face with clients, and I think that has changed as well. Maybe shifting in project teams just because of availability and who's able to come in versus not, and essential workforce versus not. So that factors in on the who. The what you're doing. We've had a lot of clients look at really more of a staffing pool or a staffing model. And I think a lot of that goes towards reskilling and thinking about what skills you do have within your own workplace that you can pull as needed when some areas are going to be more busy than others. And I think HR has been a fantastic example of that, right? It's been, for a lot of our clients, all hands on deck from the HR perspective. The when you work certainly has gotten shaken up in terms of the hours that you come in, how late people are working, learning how to flex and turn things on and off when they're working from home and those days being extended. Where you work, certainly physical location versus working remotely, and whether you're on the beach, right, and you're sitting in a condo working for your 8 hours, and then, you know, being with your family in the evenings on vacation. So I think that's been shifted a little bit. And then how we do work certainly has been challenged. So just kind of now that employees have gotten a little bit of a taste of working from home, how do we think that that's going to be changed or impacted long term? And does that totally change the value proposition? So I'll come back to that and give a couple client examples on that one, but I think that's really important. Okay, so the next question that we have here is current challenges with supporting on-site essential employees. So employees not coming to work due to fear, you know, mask wearing, maintaining social distancing, the virus or antibodies testing, whether you're doing that, not doing that, other essential PPE, and then no challenges, which for those that check that, you know, I'm going to ask you what you're doing, and then other. So. And this is for your on-site staff. So not necessarily, of course, those working remotely, but those that are on-site.
Just in general, I want to add that we've had quite a few clients that were so reluctant to have people work at home, and just some of them would not do it. And now they're calling in saying, wow, we're getting a lot more work done.
Absolutely.
None of this time around the coffee machine or whatever.
Yeah, we polled all our colleagues out of 700, and a lot of people on our core team said, "I'm good in perpetuity. You can count on me at home." And by all means, let someone else go ahead of me. I'll take my time, and I think feelings wouldn't be hurt if they ever came back in the office.
It is really going to be interesting. We also have a client that's the largest commercial real estate developer manager in all of Central Kentucky, and boy, they're certainly looking at this saying, what's going to happen here? If you're at work, you need more space. If you're not at work, you don't need as much space. So it's going to turn that market a lot of different directions here before it settles down, I'd say.
Yeah. Well, it's interesting. I have a client, they're a global consulting firm. They have about 300,000 employees, and we did a big total reward strategy study for them. And the number one thing employees asked for was flexible working and the ability to work remotely. They have people that, work in India, but have clients in the US, and they have to go into the office, right? Even though they're on completely different schedules. And the client essentially said, no, that's off the table. It will not work in our environment. We're a consulting organization. Clients want to see, their employees physically there. It's not going to work. And that was in, I think, late February, we had our last meeting. They're like, take that one off the table, right? And then we circled back and we're like, what's the first thing you implemented, right? It was like, oh, remember that work from home, working remotely and flexible working recommendation? Somehow we did that globally, but it is, I think, interesting to see how organizations that were extremely resistant or just thought it doesn't work in our industry, right? They made it work, and it's done really well, and people are very surprised on how effective that it's been, so. Okay.
When we look at this poll here, in my mind, it's kind of three categories: the willingness of employees to come in, which 70% roughly say they will. The second is to say, do we have key equipment and things needed that'd be an obstacle of people coming into work? And most clients we talk with, the answer is no. The real piece is the social behaviors. It's getting the employees to work in a new environment and wear the mask when they should and shouldn't, maintain the social distances. And as a manager and thinking through that, that's the piece that worries me the most. It's not about the willingness of the employee to come in. It's not about the equipment and readiness of the employer. It's a change in mindset of how employees need to work in this environment that I think is going to be very, very challenging. And we've seen it in the restaurant industry. We've seen it in other organizations that out of necessity have had to figure it out. And a lot of organizations, it's not necessarily out of necessity, but it will hit in this Q3. LaCinda, perspectives to add?
Yeah, I know there were a couple comments over here just on the Healthy at Work officer, and Mercer has designated Kelly Bright, our current office leader, as that Healthy at Work officer, and really she was the one that looked at local practices and came up with the training materials for our managers and really all of our employees on what it means if you are coming back on site. So that's sort of how we've dealt with that Healthy at Work officer, but I think that's a big piece of it. The mask wearing is an interesting one because should you bring your own? Is there one provided? And are you washing it daily? I think that's one of the big questions that we've gotten there. So it's just a matter of, I think the biggest challenge is some people take it much more seriously than others. And how do you handle those that don't, right? And so those that are trying to adhere to the guidelines, and when you're in the workplace guidelines, the CDC guidelines, the state guidelines, right? They're sort of all working in tandem with one another, and just making sure that your employees are really aware of what those expectations are if they're going to be on site.
Yeah, I analogize this no different than about 10 years ago. Our office in Louisville moved from its Muhammad Ali location to Market Street, and we put our square footage went in half, same number of employees, and the change management of the advantages and disadvantages of being an open architecture and employees closer. It was a lot in just professional courtesy of what you can and can't do at work that we had to do a significant amount of training. And again, I akin this no different, that I think employees will need significant training. It'll require a lot of managers to have conversations with people that aren't comfortable. And you're going to have different degrees of people, like LaCinda said, how serious they think this needs to be or not. And it's going to be a challenge.
Yeah. One other thing that I think isn't on here either is just kind of eating at work. That was another thing that's come up a couple of times, right? So if you are in a location that doesn't have a lot of restaurants nearby, or the restaurants aren't open or accessible, right? And you have to eat in the office, you have that shared eating space or lunch space, and how that area, that common area, is being handled, having multiple people trying to heat up their lunch or in the refrigerators, and how you're going to manage that. So, you know, kind of just the logistics of, even if I bring my own lunch, you know, if you have a lot of people that take lunch at the same time, how are you going to flow people in and out of those common areas? So I don't know if anybody wants to share on that, kind of what you've done for your common areas, or sort of to help employees know best practices for eating at lunch in those social or common areas. I think that would probably be helpful for many.
Yeah, I have a friend.
Go ahead. Wow. Yeah.
I have an associate that manages, he's a risk manager for Walmart for all of Kentucky. And they had to immediately take out half the tables in their break rooms. And then they started expanding the space. So you'll see that they put up, you know, fake walls and stuff just so that they can get people in and out of there, you know, on a timely basis. And so got to get innovative with this feeding people at work.
Yeah.
Give them some space. Yeah.
You have more microwaves and they're more spread out, which means you have to have more counter space to be able to do that, or put them where they weren't there before, right?
Exactly.
Yeah.
We plan to talk a little bit more about this on another poll and at the end, but a lot of the organizations we do work with, especially the larger ones that are all across the US or global, you think about trend-wise the last 5 years, they've greatly leaned down their HR team. They've supplemented that with technology investments in human capital management systems like Workday, more self-service to the employees. So they've leaned out HR and replaced it with technology. And in a time like this, most organizations do not physically have the HR staff to cover the basis. So it had to fall in the laps of local leaders to execute it, to work with the risk management, the business resiliency, where 5-10 years ago, this would have been a white glove treatment handled by HR. And you had leaders have to step in those roles at this time and execute that for a lot of our clients.
Okay. So a lot of people saying they left out sanitizers, kind of moved seating or spaced apart chairs, marked off where you couldn't go. I was out of town this weekend and I went to a restaurant for like the first time, and it was a diner that you went in and ordered. You know, at a diner, you have a long table. So essentially you had this huge long bar and only 2 people could sit there 6 feet apart. So it was very interesting. I think they were at max capacity at 2 people. So just spreading people out, and really it was marked with tape, right, where you could and couldn't go. So I think that you're going to see more of that. Okay, so let's go to the next one. Okay, so which of the following remote, so this is for those that aren't on site, the remote work challenges has your company or organization encountered? So overseeing those virtual teams, and you can select more than one of these. Less efficient remotely, mental health, social isolation, economic anxiety, virtual communication and collaboration, maintaining the prior culture in a remote setting, other, or none of the above. So one of the things that I know Mercer has done when it came to remote, and we've seen a lot of our clients do this, and we've actually helped a lot of our clients do this, is making sure that they're doing regular pulse surveys with their employees on how is your mental health. You know, do you feel like you're able to get the work done that you need? Is your workload too much? Is it not enough, right? What are you struggling with? And really allowing even open-ended commentary that our leaders are reviewing. And honestly, for each survey, we've done one every 2 weeks. And at the end of each one, we've circled back with the employees and said, these were the top concerns that we heard, and this is what we're doing to address those, so that people felt like that it didn't fall on deaf ears, right? That they were getting some response, or at least some support from leaders in the areas that they were struggling with, or what has gone really well. And we were able to track the results of those surveys every few weeks to see how things were changing and either getting better or worse in certain areas. Okay, so it looks like virtual communication and collaboration. So the mental health, social isolation, economic anxiety issues, just sort of what support did you have in place to help with mental health or things that might come up. One of the ones that I think, and actually it was the highest response here, that is really interesting is the maintaining prior culture. So you've taken, organizations that had worked really hard to develop the culture that they had, and culture takes a long time to develop, as you know, and then they moved into this virtual setting where it sort of all went out the window, right? How do we keep that culture when we're not all face to face and everyone's working relationship has changed, everything around them has changed, right? They have all of these things that they're struggling with or anxious about, and we're trying to keep that culture. So would love to hear how others have really worked to maintain that culture in a virtual setting. And I can share with you a couple of the examples of just some cool or fun things that we've seen. So one thing that we heard in one of the sessions that I was in that I just thought was pretty fun was on some of their broad calls that they have, they would do like a theme. So wear your oldest t-shirt today, right? Or wear a crazy or silly hat day. And so you'd have 100, 200 people on a call and everyone sort of participating in these, theme type of days just to boost morale. We've heard, and I know Mercer's done this as well, when you have large town halls or group leader sessions or weekly check-ins or staff meetings, whatever you call them, to have breakout sessions. And I know Zoom and some of the other technologies allow you to do this very easily, where you have 150 people on a call, and for 15 minutes, it randomly breaks you up into groups of, say, 6, 8, 10. And those employees can introduce themselves to one another if they don't know each other. You can do some planted questions, like dinner type questions, right, where you just allow them to have a social moment to connect. And so I think that's been a really great way that we've seen organizations doing that. We've had movie trivia, we've heard of scavenger hunts. So a lot of different ways that organizations are trying to keep that morale up and trying to keep some sense of their culture in a virtual setting.
Yeah, I'm seeing on the right here some folks saying weekly check-ins, hot topics. To build on what LaCinda said, that the technology for us has actually been great. The ability to get things done, I would say, is 95 cents on the dollar. The big concerns is pockets of people having emotional and mental issues being at home. And it could be someone that's at home with 4 kids, not picking on LaCinda, or it could be someone that's young and lives in an apartment by themselves that's getting cabin fever. But really, the others I've noticed is time management. It's not time management of getting the core job done, but spending extra time that would naturally divert into career development and other non-core job related initiatives. People just aren't getting those frequent cues. So the advantage of having someone in an office, in a workplace, their manager, their team is giving them role models of how they need to do things. They're giving them constant cues. That's not happening. So a lot more coaching on time and career management in very creative ways to try to infuse culture and life into people in a virtual world.
Doug, one of the things that I've seen along those lines, with the silly shirts and things, when we've had meetings, we've had some of them we've done, some of the clients have scheduled after hours, and they've actually done a happy hour with their employees where they get them together, they talk about things, and they allow them to have a couple of drinks while they're doing it. And I've seen that help with some of the morale issues as well. I mean, you have to let people live a little. So that was funny because it never happened before, but now virtual happy hours where people are just sitting in front of their computer with a drink, talking to their boss about whatever. So I thought that was interesting too, along those lines.
We have been doing virtual happy hours, but we're doing them during work, like the end of the day on a Friday.
Wow, okay, all right.
Yeah, Friday, 4 o'clock. And a couple of weeks ago, Papa John's is everywhere, and our employees are not all in Lexington. They're scattered around. And so we had pizza delivered to everybody's house. And we haven't tried sending bourbon yet, but we have noticed that we've got a couple of bourbon enthusiasts, so they've been, enjoying the happy hour.
Yeah. I think one thing too is interesting is seeing what clients are doing for the workforce that are furloughed, right, or that aren't currently working. And I know there's been a couple of local organizations I've talked to. One of them I'm on the committee or compensation committee for, and they have sent care packages to those furloughed employees, right? With, we're thinking about you, we want to recognize the work that you did, you know, you're still part of our team. And so really figuring out a way to connect with those furloughed employees just as much as you're trying to connect and touch base with those that are working in a virtual setting. So.
And in addition to the furloughed employees, a lot of organizations, and we'll get to this on the next slide, is cost containment, suspended their internships because it was difficult to do virtually, and or delayed their college hires, and trying to stay connected to that population and offering virtual learning series for the interns that would have come in, staying close to the college hires and communicating. So not only trying to connect with their furloughed employees, but the new talent that they do need to come in later this year, early next year.
Yep. Okay. So kind of to that was mentioning, this is on labor cost reduction. So what actions have you taken to reduce those labor costs? And it starts on reduction in force and furloughs, any type of voluntary program that you've pushed out, whether it's early retirement windows, voluntary leave or part-time, that's what we're getting at there. Suspended or reduce the 401k, hiring freezes, reducing pay, so doing a pay reduction across the board, whether it's executive or the workforce, delaying or eliminating merit increases, reducing or eliminating incentive bonuses or other.
And as we wait for the results here, and this is part, a lot of organizations will say this is in the respond phase, but as companies look to return, we're going to talk about where we see them turning these off or maybe having to revisit some of these decisions just because of the cumulative business realities. And later we'll get into the reinvent and where we think we may see some of these dollars redeployed.
And just to give you a sense from kind of our global survey that we're doing, we had about 20% say that they were delaying or rescinding merit, right? So 1 in 5 organizations there, 10 to 15% reducing pay either at the workforce level or for executives. So pay reductions certainly up there as well. And then about 14% saying that they were reducing or eliminating bonus pay. And that's kind of to date. There's many organizations that are going to have bonus implications that fall into 2021 with respect to what was earned in 2020, and we're yet to see that, but that's kind of action-wise what we've seen across the board. So when you look here, it looks like about 15% reduction in force, about a third doing furloughs, a small portion doing early retirement or voluntary type approaches. And I do a lot of work in the severance space and run Mercer's US and Canadian severance survey. So I've gotten a lot of questions on this. And this one has been a big challenge doing something voluntary because while many employees and employers see it as valuable and that they're letting it be up to the employee if they want to, reduce time or if they want to exit the organization and get a severance payout, it has implications, as you know, in terms of being able to collect unemployment benefits. So many clients have said, man, we don't want to make this a voluntary thing and prohibit this employee from getting unemployment. So that's weighed into that decision heavily. And then the uptake on those is much less prevalent than what you would see in a normal environment because people are very hesitant that if they're, let's say, in healthcare and they take a voluntary program, are they going to be able to get another job, right? So I think just offering those and getting a great take-up rate is pretty slim. So I think that's why we see that being so low across the board. About 15% suspending or reducing the 401k, 30% doing a hiring freeze. I think many of us, our hearts go out to graduating seniors, whether high school or college right now. 11% doing a pay reduction. Right around what we're seeing in the global survey for that one. About 40% delaying or eliminating merit and 16% reducing incentive. One thing that Mercer is doing is, as you know, we have a ton of compensation survey data. And so we're watching that data and looking to do almost a quick update survey late summer, just to understand how all of these pay decisions are going to impact compensation planning for the fall. And so be on the lookout for information there on compensation survey data and how that's changing. And we're already getting questions from our client, right? Should we be having market pay adjustments? What are we doing if we are doing some type of merit? but we don't have the full freight. Where do we prioritize? So I think we're going to see more and more on that. And this might be the first year since 2008, 2009, that we see something other than 2.9 or 3% for a merit budget across the board. Unfortunately, it's going to be lower than that, but I do think we will see change this year from a compensation perspective, and many organizations holding constant. And when we see that, one of the implications to really think about is you might be in an industry that needs to freeze pay or needed to reduce pay or needed to do furloughs, but not everyone around you did. And so when you have employees that are marketable in multiple industries and they can cross over very easily once things continue to open back up like we're seeing, I think flight risk is huge. You've got other employers that didn't have to make those cuts and that are still going to pay out bonuses, right? And that could be very attractive to an employee. So really keeping a close pulse on retention, honing in on that culture that we mentioned earlier, and creating that tie to your organization is going to be critical, because some employees are just going to say, it's not worth staying. I don't have that loyalty necessarily. And I experienced, whether it's a layoff, a furlough, or any of these types of things, actions that have been happened, a pay reduction, I'm going to look elsewhere. So I think the job market, when we see jobs continue to open up, it's going to be a pretty big war for talent. Employees are going to want to make a change. So Doug, what would you add to that? There's a lot here.
Yeah, so everything we've talked about is the broad workforce. I'd like to just give a little bit of lens at the executive level and some of the work I'm doing in team, and go through the three buckets of what we've seen on the base, the short-term or bonus, and long-term, and then beyond. At the base salary level, obviously the executives and senior team have been lessly impacted by the RIFs, the furloughs, but when there's been a decision to reduce base salary, proportionally, they've been the first ones to have the base salary reduced, as well as a higher level. We keep track of about 3,000 publicly traded companies on a regular basis and what they've announced in the public airwaves, and about a quarter announced some type of workforce action, and in there a little more than half, so to LaCinda stat, about 20% announced they were reducing salary. And when you looked into that, 70% was just the executive team. The other 30% picked up the broader workforce. And when you looked at the level and duration of the base salary reductions for the senior executives and their direct reports, it was at a much higher level. Rather than like 20% for the broad workforce as our median, it was 50% for the executives and maybe even 75 at the 75th percentile. So 0.1 more likely to reduce base salary and at a higher level. And then tactically, the impact of how that ripples to all other elements of executive pay, a lot of issues and challenges. On the bonus, a lot of organizations still just let their bonus program go out as is, but plan a ton of discretion at year end, that they're going to look out at payouts and make sure it's collectively, it's directionally in line with all the shareholders and stakeholders that would have this lens. And that's the investors, the proxy advisors, the customers, their employees. And in there, again, we expect discretion. We expect probably the curve to be flattened out on the bonus payouts, that the threshold to get something will be moved to the left, but the maximum to get that will be moved out to the right. So that curve will be flattened down. And then for publicly traded companies that issue options that are significantly underwater, we do expect the discussion of option repricings and exchanges, not likely for the named officers and the proxy executives, but for the rest of the workforce. So those options are no longer effective. They affect their outstanding available for awards, and they probably will work with investors to reprice. And then at the executive level, we're already starting to see retention issues in certain industries that are doing well, that you're having executive poaching. So a lot of concern the balance of the year. And do you think Q4 is going to be interesting for calendar year companies, as they have to make some hard decisions on bonus that was right for what the executives did, their business, but directionally consistent with all the stakeholders?
Yeah, I think, Doug, you've seen executive shakeup in industries that you might not expect it either. So healthcare has been one that I get the Becker report every morning, and it shows what executives have changed or shifted and where CEOs have moved. And it's crazy to think about a healthcare organization that potentially is undergoing one of the toughest times that they've had in history, and then them getting a new CEO right now, but it's happening. Their changes are still happening. So I think that's a great point. Okay.
And building on that is our acquisition team believes there'll be a lot of what we call discounted or opportunistic M&A opportunity in Q4, that there was ones that were held off for price, and that some organizations are going to end up on the high good end of that stick, the other the short end. and that'll result in a lot of change at the C-suite.
Yep. Okay. So this next question is just kind of looking back at, okay, social distancing guidelines, let's say, are now removed. We're at some point in the future. What's your plan as an organization? So we know that there's a lot that are not sure and they're monitoring that situation, which is the last response here. And then others have said, you know what, we're going to continue working virtually short term, or we're going to continue working virtually long term. Definitely, as Doug mentioned, Mercer is in that we're going to continue working virtually short term, as are many of our clients that can do that. But curious if you guys have had these discussions and made decisions in terms of when social distancing guidelines are removed.
Anybody letting their employees weigh in on this? Because it'd be interesting to see what employees think about it. I suspect a lot of them would like to continue to work at home.
Yeah, Lyle, that's a great point. And one thing that we're suggesting, and we did ourselves, is we did a return to work survey with our employees to say, do you want to come back? Yes or no, right? If you do want to come back, how many days a week do you want to come back? What floor do you sit on? Who's your manager, right? So that we could start understanding from a planning perspective, if we can only have 50%, we know who's essential and who needs to be there, but beyond that, how do we want to prioritize it? And as Doug mentioned, I have 4 kids, and I have loved getting to be with them more in the mornings and the evenings and not having to travel to and from work. And so I don't necessarily need to come back until they say, all right, we're ready to have a greater capacity. We have some younger people on our team that are just dying to get back. And so taking their perspective in and trying to open it up to those that really want to come back to the office and are going stir crazy, we're trying to accommodate that as best as possible and have done, again, a brief survey just to kind of gather that feedback.
Wow. Well, we personally have grown significantly this year, and we can't have everybody back in the office. There's not room for them all. I'd considered expanding the office already. We decided not to do that because of this, but we're going to have to find a way to continue this virtual working.
Yep. So it looks like about 40% are not sure. Not surprising there that that's the most common response. About 15% are continue working virtually short term. A small percentage saying they're going to continue long term. And then you have about a fourth that are saying we're returning to on-site working for all employees once those guidelines are lifted. So kind of just some interesting responses here. And again, kind of think through how you're going to prioritize who gets to come back short term, who gets to come back long term once you've moved beyond that essential workforce. One other comment before we go on to the last poll is we have a great partnership with a firm called JD Expert, and they're a job description software tool, a really awesome organization. But one thing that they looked at the very beginning was, from a job description perspective, should there be a way to identify those essential employees? Because many of our clients said we didn't really have that identified. We had some general ideas, but if we didn't have the right technology in place or the right HRIS system or platform, we didn't necessarily have that piece of it. And so JD Expert is saying we've now created a place on our job description template that you can complete, whether it's an essential employee or a non-essential employee. So just something to think about too, as you think about long-term changes that will be made as a result of all of this. That's one thing that we've seen so far.
Interesting.
Okay. All right. So then the last question is, in hindsight, right? So which of the following would you have planned for better if you knew that we were going to be facing a pandemic? For those, I think at the bottom, there's I don't know if you can see it here on the screen, but I think there might be a none, right? And for those, like, hats off and kudos to having it all in place. But there is identifying essential employees, which I just talked about as a big one. Cross training to be able to pull and play. I know I've worked with organizations that said we did have to furlough some people, but we essentially put them into a staffing pool and we gave them opportunities when stuff came up. If they had an applicable skill set, they could come and do that short term instead of being out on furlough. So that's a big one. Virtual processes, onboarding people virtually, right? Knowing how to have meetings virtually. I think there's a new phrase being coined on being Zoom out, right? You're just like over being on video conferences all day. But I know there was a comment over here on the side that said we terminated our temporary employees that were like contractors. And that's one here, right? Less reliance on contract workers. I think, unfortunately, the world has moved more towards a contract or gig kind of workforce. And those were the first people to be let go for the most part, right? Is if you were not a full-time employee, unfortunately, we're ending that contract until we need to pull you back in. But the contract and sort of self-employed folks really, I think, got hit very significantly during this time. So let's see here what responses were. Doug, anything you want to add on this one?
Yeah, I think what a lot of organizations are struggling with now is the processes to do this, and a lot of it was manual. Lessons learned for us as we'll go through here, and some of it was gaps in skill sets as we're talking about as far as people to work from home and the technology. But for us at day one, getting the list of essential employees, and while we have a very robust system with Workday as our human capital management, it's a great system of record, but companies are struggling with systems of action and to handle logistics as people return. And that's the piece that's challenging, is the execution side of it, not the cataloging what's happened looking backwards.
Yep. And then Chase, do you mind scrolling down so we can see the bottom? I think there's maybe one response that isn't showing on the screen.
I've scrolled as far as it's just
Oh,
none of the
okay.
above. It's either not other or none of the above.
Do you know
You
what
can
those say?
scroll individually on each of your screens.
Oh, there you go. Yeah, there you go. Okay.
Bottom.
Other than none of the above was very, very low, 2% and 4%. Okay, so the virtual processes and onboarding, I think that was a big one that everyone had to adjust to.
Boy, we've hired an employee that I have not yet met. But she's worked great for 2 months. So, I mean, I've met her virtually a lot, but I haven't ever met her in person. That's an interesting new approach,
Yeah. I think the better succession planning one is another one to call out. As organizations thought about doing furloughs or even early retirement windows, some hesitancy there, especially on the early retirement window side, to say, unfortunately, right now, we don't have anyone that would step up, right, to fill that spot if this experienced worker who sort of has all the knowledge leaves. And so it has really challenged organizations to think about that longer term, to make sure that they don't have functions that sort of have sole knowledge with one or two people, so that if they do need to sort of pull some triggers or pull out some stops, they have a game plan for moving forward.
Yeah, last piece to add on this is we're going to talk in a moment about some additional areas we've seen happen on the reward side around employee value proposition and geographic differentials across the country, but a lot of focus on the structure of the HR team and the technologies to deliver. And organizations coming to us and they're saying three things are true. The composition of our workforce and how they're going to work, when and where, is different. Therefore, the HR team in size and skill set and activities is going to change, and likely some changes in the technologies needed to make it happen. And again, going back to this concept of more ability of systems of action to engage the employees and realizing not all of them will physically come into the workplace. So a lot of our work is around organizations saying we need a new HR mousetrap to deliver our new business realities. At the same time, we need a new reward equation for our employees. And at the same time, our employees' view of us is changing as well, and how do all three converge. And we'll kind of hit those last two pieces that LaCinda will talk about as organizations rethink the workforce they need to deliver the new business reality. What's the employee's sentiment of their attractiveness at different employment opportunities as well?
Yep. Okay. So just a couple of things, like Doug mentioned, that we didn't have necessarily a poll question on, but I wanted to kind of get out there before we open it up to Q&A. One of them, I talked a little bit about flexible working and how we think the EVP is changing, but I think the other thing that we are really seeing and talking to clients about is the low wage earners and what's happening to that group of employees and what expectations they now have. And Mercer has a total rewards triangle that, if some of you might have seen, that essentially lays the foundation for total rewards. So at the base is compensation and benefits, and then you layer on careers and well-being, whether that's health or financial well-being, and then at the top is purpose. And sort of permeating through that whole triangle is culture, right? And how that varies from organization to organization. And what we've really looked at is for low wage earners, how does that triangle now look a little bit different? And what we've done is essentially taken the Maslow's hierarchy of needs and put that below compensation and benefits to say, before we can even start at the pay and benefit level, we have to meet some of these, rudimentary needs that an individual has. That's food, that's shelter, that's transportation, right? Childcare, the kind of things that really prohibit them from maybe even starting at the compensation and benefit level. So when you look at that from a contractual perspective, how much is now the employer going to be responsible for meeting some of those needs? A great example of this is the restaurant industry. So as you know, we have a lot of restaurants based out of Louisville. We have a big hub there. And I think what we're seeing from some of them is, do we now offer meals to our employees up to a certain amount a day? We might be able to offer $20 in meals at a $4 cost to the organization. That's a significant benefit, right? To attract a low wage earner population to come work here. They can take food home to their family a few nights a week for $4 a day. On our account. So just looking at ways that you can utilize either what you offer in your product and how to help that employee, or really rethink that employee value proposition from a contractual basis. So that's one thing I wanted to point out. And then the other thing I wanted to point out, and I know you guys have probably talked about this on previous calls, but just the effect that unemployment has had on that low wage earner workforce. They have now seen and tasted what it feels like to make almost $1,000 a week. And now that they're backing down from that, that's a huge thing to walk away from. And I'm not saying that we're necessarily Mercer saying there's going to be unions emerge, but just sort of that union mentality of fighting for more pay. We saw many of our clients really pushing that minimum wage up, and they had plans to do that over the next couple of years. They were already facing pressures from Amazon's, right? From some of the fast food chains, from the Targets, the Walmarts, particularly healthcare, where they haven't quite caught up, but they're trying to get there. This is going to just accelerate that. We might have seen it 18 months to 2 years from now. I think we're going to see it, by the end of the year. Really big pressures to get up to at least a $13 to $15 minimum per hour. As we saw organizations put in short-term either pay bumps or bonuses for this time, if they enhance the wage, employees are not going to want to back down from that, and they're going to fight for that additional compensation. So I think that's another big thing that we're going to see really causing pressures. And then the last piece, just on the workforce comp that I wanted to mention was the geographic differential. And Doug mentioned this a little bit earlier, but we have so many more employees working remotely, and employers that have not previously had to really think about how they were paying that work from home workforce are really looking at that now, right? And they're challenging maybe what they did previously. They're trying to understand, is it a benefit? Or do we have pay equity issues if I have let's say, Doug working in the office and LaCinda working remotely 2 miles down the road? Why am I paying her at a different rate to do the same job, right? And maybe LaCinda is more effective from home than Doug is in the office, but he's physically sitting there. So I think, we've seen a lot of questions there, and I think we're going to continue to see that evolve over the course of the next 6 to 12 months as employers really look at that remote workforce. So Doug, I'm going to allow you just a few minutes if you want to talk about a few additional executive comp implications, and then we'll have a few minutes for questions for what we haven't gotten to.
Yeah, I think key to build on the broad workforce. Honestly, the end byproduct of this is going to be a revisit of the total rewards. And think about, from an employer's point of view, it's going to be a three-pronged process. They're going to have to reassess long-term the revenue side, their customer base, and what is the income upside of their organization. Second, post-COVID, what is the size and composition of the workforce needed to deliver in the new business reality? Does it completely rebound, or does it look different? And third, if they kept their rewards constant, does that spend still work? Does they still get to the same net income needed as an organization? And the answer for a lot is going to be no. So then they're going to have to look and make changes and pull levers, and do expect a lot of change in the hourly workforce and their compensation and how you pay people creatively. Do expect in the health and welfare space much more differentiation and segmentation and choice of medical benefits and time off for that workforce. And then lastly, my wager is you're going to see companies across the board continue to pare back retirement spends through 401ks and accelerate freezing the pension plans that are still going as a way to try to balance. And so I think the end result is there's going to be a reprioritization, likely a reduction in the total reward spend, and now that EVP hits different segments of the workforce to be determined. You know, to LaCinda's point, at the executive level, I do think Q4 is going to be real interesting and stressful boards and committees to revisit, to sign off on bonus outcomes. I am curious how critical the shareholder groups will be, the proxy advisors like ISS and Glass Lewis, the shareholders, or if it'll be so much volume hitting the press and hitting the world next Q1 that organizations that generally follow the right framework will be left alone and just the outliers will get attention. But I don't envy the board members, and our exec comp this Q4 is going to be very, very busy.
All right.
Very interesting.
Well, I'll turn it back over to you, and certainly open for Q&A. Any questions that you have for Doug and I or for the rest of the team?
Thank you all very much. What a pleasure to have you on here. And this is great to have the interchange, and I'm glad people continue to write in questions. We'll take any more that are coming in now. Allison, have you noticed any that have come in that we ought to address that we might not have hit so far?
I did get a question about labor law posters. They ask if your company is working 100% remotely, how, Jim, you might recommend we display those to remain legally compliant. Do we need to email them or post on an intranet or anything like that?
Yeah, we actually talked about that. I think it was week 1. But as these things happen with, if you're allowing people to work from home, you are required to still post posters, which is kind of funny. But we recommend that you send those to each one of the employees, alerting them, not the posters, the alerts to them, advising them of the policies and so on. We actually had a whole work from home before this ever happened, a company that is focused on all remote phone answering services. And we worked with them on the packages that had to go out to each one of the employees. It's a little different for work from home only, but generally speaking, as long as you are notifying them, and you could always send them the small posters and say, this is what you put in your common area, wherever it is that you wish to put it. But it's just kind of a different world now, and I don't know that some of those poster requirements have caught up to the at-home situation. But that's kind of the gist of it. And do keep in mind, there are new posters that have been sent out right now during this whole process, and we've talked about those. I had them up on the screen, week 1 and week 2. Some of the new instructions from OSHA, from some of the others that are mandatory to put out there. The DOL came out with several, and we pointed out where to find them, what to do with them, and so on. And then the governor also has ones for as people come into your physical location in different languages and so on, that basically point out to them what the health is and so on.
A lot of people get their posters. The Kentucky Chamber has a whole series of posters, and they're putting out a digital version of all those posters now, so it's pretty easy to get copies that you can send around. I don't think people are going to be posting them in their dining rooms, their bedrooms where they're working from, but it would make it kind of comical. Any other questions, Allison?
I think Jim's done a great job of answering them in the chat as they came in. So unless there's any of those that you specifically like to call out and address to the group, I think we've.
I do see one at the end there, the legal update on healthy at work. I have an update on that, and I'll just let you know there is no information from the governor on that. I still was hoping that we would get some type of good faith indemnification for an employer who does it in good faith. The one thing I've not mentioned it, but I think I will. Anybody who volunteers to be a healthy at work officer, you have to start to wonder what their liability is when there is no legal framework from the governor as to what's required. That person is now responsible as the representative of the company. Then you have questions and concerns about whether that individual has done their job appropriately, were they appropriately trained, and are they going to be responsible if they do something wrong or somebody gets COVID, a customer and so on. That's one of the reasons why we strongly encouraged that the governor post some kind of guideline. Hey, this is what we want the Healthy at Work officer to do. And hey, as long as you do some training, ABC, or follow the following, then this person and the company are immune. Because that's a pretty serious, you're taking on a serious responsibility. And we have not talked about individual liability on that, but there's a concern there.
And we did post sorry, I'm getting some feedback here, but anyway, we posted a job description a couple of weeks ago, and we're glad to make that more available to people if they need it. It's just our draft that we shared with the governor's office. Allison, I noticed there's a little more on here.
Yes, so we've got, since the new changes passed by the Senate regarding the PPP, does all the money need to be spent before using the 2/3 pay set forth by the paid leave entitlement?
See, those are two different laws, and that gets into a whole lot of legal. And I want to go ahead and say as well that the next question on there also gets into a tremendous amount of legal, a tremendous amount of interplay between different rules and laws, and it puts me into a situation where, okay, that's actually giving like individualized legal guidance. Because when you start talking about somebody who's on EFMLA that needs FMLA and then may need EFMLA again, that question, and then the one about the 2/3, you're mixing the PPP with the FFCRA and with the sick leave, and it depends on which one you're talking about. It depends on specific circumstances, and you're really getting into really where you need to contact your legal counsel and get direction on a specific issue related to a specific employee. And that's where I'm not allowed to give that without a client relationship, because now it's going beyond just the scope of a webinar discussion. Sorry. But I am trying to catch all of these and do as much as I can. So,
All right, let's wrap it up for the day. Thank you all. I want to go back to our Mercer team here, Doug and LaCinda. Great work. Many on the call know I worked with them for 13 years and just always proud of the quality of work they do and the great attitudes they have. And I think this has been fascinating. Thank you all very much for joining us. We appreciate your time and all the good information you shared. Jim, back to you again for just a moment. We thank you for all you do. I know this is a ton of extra work, and my whole team, I appreciate the effort you put in. We haven't had a free weekend in 12 weeks, it seems like, but we're getting better and better. Thank you all that you participated in this today. I hope you got a lot out of it, and I suspect we'll be back next week, so put it on your calendar, and we'll look forward to bringing you the latest then. Until next week, I'm Lyle Hanna, and this has been another good session. Thanks for joining us. Be safe. Wear your masks. It makes a difference, and encourage others to do that. We'll see you later.
Thanks, Lyle.
Thank you.